Among patients with chronic coronary syndrome and an indication for long-term oral anticoagulant therapy, the appropriate antithrombotic regimen is unclear. This is particularly true for those with previous stent implantation, in whom antiplatelet therapy may be needed to prevent stent thrombosis, and in those at high atherothrombotic risk. A new trial examined the efficacy and safety of adding aspirin to oral anticoagulant therapy in these patients. In this multicenter double-blind placebo-controlled trial, 872 adults with chronic coronary syndrome, previous stent implantation, and high residual atherothrombotic risk who were receiving an oral anticoagulant were randomly assigned to add 100 milligrams of aspirin or placebo once daily. The trial was stopped early due to an excess of deaths from any cause in the aspirin group. The primary efficacy outcome was a composite of cardiovascular death, myocardial infarction, stroke, systemic embolism, coronary revascularization, or acute limb ischemia. During a median follow-up of 2.2 years, the incidence of a primary outcome event was significantly higher in the aspirin group at 16.9% than in the placebo group at 12.1%. A secondary efficacy outcome, death from any cause, occurred significantly more often in the aspirin group, in 13.4% of patients, than in the placebo group, in 8.4% of patients. The key secondary safety outcome, major bleeding according to ISTH criteria, also occurred significantly more often in the aspirin group, in 10.2% of patients, than in the placebo group, at 3.4% of patients. The authors conclude that in patients with chronic coronary syndrome at high atherothrombotic risk who are receiving an oral anticoagulant, the addition of aspirin increased the risk of a composite of cardiovascular death, myocardial infarction, stroke, systemic embolism, coronary revascularization, or acute limb ischemia, as well as the risks of death from any cause and major bleeding. Full trial results are available at nejm.org.